So, starting off with Module 2, we're going to delve a little bit deeper into intellectual disabilities and more specifically, what are the causes behind them. So, in this particular module, we're going to first talk about kind of genetic and biological causes. And then in Module 3, we'll follow up with things like environmental influences. So, what are the causes of intellectual disabilities? So, one of the areas that we're going to see are genetic influence. You can see this in the form of chromosomal disorders, or there's a lot of genetic mutations out there. Some of them are very infrequent, but nonetheless still contribute to an intellectual disability. You can have it where single genes that can be responsible for the intellectual disability. Usually, dominant genes are less often responsible for intellectual disability because people with intellectual disability are just less likely to have children. So what they are typically are more recessive genes, and we see that with an awful lot of chromosomal disorders. So in other words, it kind of gets into an evolutionary sense where those with low functioning intellectual disabilities are very unlikely to have offspring, therefore not passing on dominant genes. But if somebody is more in just a normal kind of intelligence, what you will see is that it's more likely to pop up. Unfortunately, a lot of cases of intellectual disability just really don't have any identified cause, or what's sometimes referred to as an etiology. Now, one of the more better known chromosomal influences that we see is the issue of Down syndrome. It's the most common of the chromosomal causes of intellectual disability, causing moderate to severe disability intellectually. And it is caused by an extra 21st chromosome, which is why the disorder sometimes is referred to as trisomy 21. As you can see there to the individual on the left, there are distinctive physical symptoms that we see, especially in the face. But we have things like slanting eyes with kind of an extra fold of skin in the inner corner at the eye, a smaller head, usually shorter stature, protruding tongues, and a variety of organ, muscle, and skeletal abnormalities that go along with it. They're going to have physical handicaps frequently and limited speech. A lot of times the cases are due to the age of the mother, but they've done some recent research and also found that the age of the father also can dictate. So basically, the older you are, the more likely you are to have a child that has Down syndrome. That being said, it's still fairly low kind of odds. What we see is typically they live a bit of a shortened life. So usually by mid-adulthood, most individuals with Down syndrome have died. On this next slide, you can see this goes into the rate based on maternal age of Down syndrome. And you see that really until 35, you're not seeing hardly any incidence at all. By 40, you're beginning to see it to increase, but really between 40 and 50 years old, which is really towards the end of a woman's reproductive life, you can see that the incidence of Down syndrome just skyrockets. And so there's a lot of reasons why that might be, but one of the big ones is that just the biological reproduction mechanisms do not work as effectively the older you get. So that's why after the age of 35, most women who become pregnant are considered more high-risk pregnancies. And then after 40, you can imagine. So the good news is that there are plenty of programs to help children with Down syndrome, and they can have a fairly productive life. There are some other chromosomal influences that we're going to go over briefly here. The first is Klinefelter syndrome. Occurs in about 1 out of every 1,000 male births. And this is characterized by the presence of one or more extra X chromosomes. So typically, you have a male is going to be an XY sex chromosomal in a typically developing boy. And in this case, they may be XXY. And so Mother Nature does not like too much or too little of what's supposed to be in there. And if you have too many of these chromosomes, that is not necessarily a good thing, just like too few is not a good thing. Which gets us into our next syndrome, which is the XYY syndrome. And this is also going to be in males. And you can see they have an extra Y chromosome. The good news is Y chromosomes really have very little influence on your overall development, other than to say whether you're male or female. So the extra Y, you don't see quite the level of impairment that you do with something like Klinefelter's, which is an extra X chromosome. As you can see, there is a record of more minor social deviance, and the mean IQ tends to be about 10 points lower than average. So the average for somebody with an XYY syndrome would be a 90, as opposed to the 100 average IQ that we talked about in Module 1. Turner syndrome is an XO configuration, meaning that it's kind of an empty second sex chromosomal abnormality. And you see this in females. It's a pretty rare condition. Those females tend to be small. They fail to develop sexually. The same goes for Klinefelter syndrome. Both are infertile. And with Turner syndrome, intelligence is near or within normal. So there are some physical characteristics for both Klinefelter and Turner, and that's what we're going to see on this next slide here. You can see with the Turner syndrome at the left here, the no menstruation. They may have smaller fingernails, widely spaced nipples, shield kind of shaped thorax, shorter stature, but they do have female preferences in general. In Klinefelter syndrome, you can see that there is poor beard growth, that they tend to have breast development. That's that second X that starts to manifest itself, particularly around puberty. They tend to have a little more osteoporosis, meaning kind of the more brittle type of bones. And you can see some of the other more kind of feminization that is a result of having that second X chromosome on top of the normal XY chromosomes that are more typical. So these are distinctive kind of physical characteristics. And then, as we talked about, there are some cognitive aspects of that too. Getting into more genetic, not so much the specific sex chromosomal abnormalities, you have the Fragile X syndrome. And what you see here, this is the most common of the genetic disorders that result in an intellectual disability. Most boys, but only about a third of the girls with what they call the FMR1 gene have intellectual disabilities. So in other words, this is going to have a more negative effect on males than females. And the FMR1 gene tends to be one, if you have it, that's going to contribute, if not to an intellectual disability, then to a learning disability. You can see some of the other characteristics of those that have Fragile X, including hyperactivity, short attention span. So you might imagine that they could get identified with something like ADHD, gaze avoidance, and then perseverative speech. That's speech that continues to have a kind of repetitive quality to it, in the perseveration. There is going to be some characteristic facial appearances of someone with Fragile X. This includes an elongated face, high forehead, large jaw, and a large kind of underdeveloped ears. We talked a little bit about the gender differences, and that women that have Fragile X tend to have much more mild symptoms than those of males. Another genetic disorder that we see can cause intellectual disabilities is phenylketonuria, that is PKU. And the underlying issue here is, and the damage is caused by abnormally high levels of the amino acid phenylalanine. Excuse me. Usually due to inherited absence of phenylalanine hydroxylase, which is an enzyme that metabolizes phenylalanine. So basically, they don't have the metabolism to break down this component, which is found in a lot of the food that we eat. If you don't diagnose somebody at birth with PKU, then they may start eating this food. They can't process the phenylalanine. It starts to build up in the system, and then the system can start to shut down and result in intellectual disabilities. best news of all of the genetic disorders and chromosomal ones that we've discussed in this module is that PKU can be fairly well prevented from having these intellectual disabilities because of a particular diet, and that diet is one where you avoid phenylalanine in your diet. And they can do a blood test usually as soon as the baby's born. So if you ever been into a birth, as soon as the baby comes out in the hospital, they typically do a little blood stick into their foot and take blood samples. And one of those tests that they're doing that blood sample for is PKU. And if they do have PKU, then they can already put them on that alternative diet straight away. So it's kind of a very hopeful sign. A lot of these impairments will diminish if the child's identified correctly and stays with the diet. So in our next module, we're going to continue talking about causes of intellectual disabilities.